Hello and welcome to Sensei Podcast. This is Manos Brilakis discussing with leaders in the field of CTO and complex PCI. Sensei means teacher or master in Japanese. The goal of the Sensei Podcast is to help you learn and improve in CTO and complex PCI so that you can become the best that you can be and offer your patients the best possible results. Hello everyone and welcome to Sensei Podcast. It is my great pleasure to introduce our guest today, who is Dr. Sergey Furkalo from Ukraine. Dr. Furkalo is the head of the Department of Cardiology as well as Transplantology in the National Institute of Surgery and Transplantology in Ukraine. And obviously he has been functioning under a lot of stress lately given the latest events in Ukraine. But he has also been for many, many years one of the premier CTO and complex operators in Europe and around the world. And Sergey, it's a great pleasure and honor to talk to you today.
Thank you, Manos. It's a great pleasure and honor to communicate with you these days. Thank you.
Thank you so much. So, Sergey, maybe we can start by letting us know, how did you get involved into the CTO and complex intervention? Was this something you always wanted to do? What made you go into this area?
At some stage of my practice, as I mastered the technique, there was a desire to expand my capability in interventional cardiology. One of such challenges was the cheap intervention and CTO. Then we did not have the appropriate equipment, appropriate materials, knowledges, and it was very difficult at start. But there was a motivation to learn new things, and that's why, based on my previous experience in more simple intervention, I decided that it's very interesting and it was a challenge for me. That's why, maybe. That's it.
And how did you learn? Was it through meetings, through working with other people? How did you learn to do these procedures?
Somewhere in the year 2006 or something like that, I was at TCT in Washington and saw the work of some Japanese masters of CTO. There I met Dr. Takahiko Suzuki and received an invitation to visit Toyohashi Heart Center. At that time he was a director or chief of this private clinic, and in 2007 I visited Japan for the first time, visited many clinics, got acquainted with the work of outstanding experts like Satoru Samisuji, Osamu Kato, Dr. Kazuaki Mitsudo, and some others. For the first time I saw how some specialized coronary CTO wires work, and Dr. Mitsudo presented me then with two wires. It was Fielder XT and Confianza Pro 12. Yes, I never seen such wires before. That's the history, and I start in 2007 some intervention based maybe even on previous sample of CTO wires, like I'm sure you know Magnum Meyer wire by Schneider company. It was one of the first such 021 wire with such ball on its end on 1 millimeters, special balloon by Schneider too, Schneider company, and we performed some recanalization with this device, such a bulky device, but nevertheless it was a history, and that's it.
And then you started doing those cases and you gradually got experience through your own cases, watching other people's cases. How easy was it to incorporate your learnings from Japan into what you did on a day-to-day basis in Ukraine?
Actually, it is not easy because we didn't have such equipment at all. We didn't have guide wires, necessary guide wires, and I started my way with help of some people. First of all, I began to get main experience by attending Japan CTO Club, by European CTO meetings. On the basis of our clinic, we organized a conference and called it Multidisciplinary Endovascular Intervention with CTO session, because I work at a multidisciplinary hospital. We perform a lot of different interventions, not only cardiology. And there were a CTO session with live case during this conference. We invited some experienced operator for such live cases, and for sure, Artis Kalniņš from Riga, we probably did the most of Proctor cases with him. We are good friends. Some other European operators, Dr. George Sianas, Alfredo Galassi, Etta Tsuchikane from Japan, and some others, they were proctors, they were mentors in our clinics, and we performed some live cases. Last proctoring session before the start of COVID and before the war, it was in February 2020, was conducted by Alexander Evran. We made 5 CTO cases of different complexity. That's the way of treating, of teaching.
Perfect.
That's it.
And now you obviously have extensive experience. Now it's been maybe probably 16 years, a long, long time you're doing this. How do you approach the cases? How do you plan for the CTOs and the complex cases that you do on a day-to-day basis?
I can't say that our clinic is high-volume cardiology clinic. I would say that it's more reference clinic for CTO and cheap intervention. That's why I don't perform a lot of CTO cases. Each year it's not more than 60, no more than 60. That's why I have time to carefully several times study the coronary angiography, angiogram of the patient condition, select the equipment. Together with my operation nurse, she is very experienced. We analyze the coronary angiography, develop possible clinical scenario, and prepare equipment. That's it in general.
And then how do you deal with the cases that don't go very well, or they have challenges or complications? Is there something specific that you do? You learned how to handle these cases? What is your general approach to this?
It depends on the case. If it is my case that it was a failure of my own intervention, it depends on clinical scenario, possible clinical scenario for future. If I think I have more clinical scenario, I would perform it second time or third time. If no, we have cardiac surgery here, and there is another way. I can I can invite I can prepare this patient for a live case with more experienced operator, or with other operator. We invite them to our live case, or just for proctoring session from abroad. That's
perfect. And which brings us to the point, actually, I'm so grateful you can make it, and obviously functioning under the current situation of war and all the limitations that come with that is not easy. So you've learned CTO PCI,
yeah, of course.
But this is probably the easy part compared to what you're going through right now. So how are you able to continue the practice right now with all the limitations, and what did you have to learn and adapt to do that?
Yes, now logistic of our traveling became more and more completed. That's why now, nevertheless, I try to visit the most important events in CTO, especially in Europe. I try to visit EuroCTO club meeting. I try to visit a male CTO meeting like this year, like previous year, and I see some live case by internet, etc., like that, because I can't arrange proctoring session, and sometimes it is not easy to organize some conference in our hospital. That's it. But nevertheless, the life is continuing, and we got accustomed more or less to this situation, and That's it.
So you make things work despite the limitations. And are you seeing more patients now with the stress potentially associated with all the events and the war, or it's about the same as it was before?
It's a very interesting situation. I prepared the presentation for ML CTO this year about condition of our service in Ukraine. It appears that last year, 2022, the general quantity of PCI increased by 10% as to compare to previous year, even with war. I asked some of our doctors and some of our officials how could it be. They said that this general condition and general movement of this direction is so quick that even war can't stop the increasing of the quantity of such patients, especially not cheap and CTO, especially acute cases.
Sure. And then in terms of the trainings and having the trainees and the residents and the fellows who come over there, how do you teach them? Is there any specific things that you try to teach them or try to make them learn?
My colleagues, students, you mean my colleagues and students or what? Yeah. Well, first of all, from my point of view, it's the most important thing. It's motivation. It's motivation and desire to know new things, to move to next level. It's the most important, and not to be lazy. It's for students, and this is the most important things. That's why I have such students, I have such young doctors. It's interesting. It's mainly young people who would like to be engaged in all this system, CTO and chip. That's why, yes, I think there are such people, and the main sign of such character, I said that it's motivation and not laziness.
And then, do you find that some people may be better with their hands, or maybe not as good with their hands? How does that make you think about what they can do? If they're not very good in their hands, but they're very motivated and hardworking, can that compensate and they can still become good operators?
I believe in that. I believe that if somebody has strong motivation, he can compensate some drawback in his handwork. I believe in that. I believe that majority of people, I would say 90% of operator, they have middle level, ordinary level. They can increase to necessary level by their work, by their hard work. 5%, from my point of view, is people who have special knowledges by hand, special, I would say, some inborn sign, I would say. Yes, they are better, but of course, if they are good in hands and they have motivation, they can be extraordinary operator. And 5% maybe people who are bad with their hands, and they can rise to middle level, but not highest level. That's the idea.
So it doesn't matter what level you are starting with. Through your hard work, you can get better and improve.
Yes, of course. Of course. I strongly believe in that.
Yeah, absolutely. And then, what do you think is the hardest thing to learn and to teach in complex and CTO PCI? Are there some techniques? Is it the way of thinking? What do you find the hardest to teach and to learn in CTO PCI?
The way of thinking. The way of thinking. As to speak about CTO, this impression, this expression, be comfortable to be uncomfortable. Yes, that's the idea. You have to got accustomed to stay a very long period near the patient and to get the result, to get motivation, to be calm, to believe. To believe it's very important to the result and to believe that you can do your best.
And is that something that you learn, or is that something that it's like the motivation to learn? Is it something that you're born with?
No, it's something that I learn from people who were in this jam before me, and from a good operator, and from my father. Maybe he was a cardiologist too, but not invasive, but he was a doctor too. Yes, that's it.
And then, are there any specific cases you can remember that, good or bad, that you really remember and they taught you a lot during all these 16 years you've been doing these complex cases?
Yes, I would say there is such case. It was a very interesting case. It was a patient. We did it 6 times after 2 previous bypass, 6 approaches, 6 unsuccessful approaches. And the last one we performed together during live case with Dr. Etsushikane. He came to my hospital. He looks at this. It was LAD CTO. Previously, it was trained by me, George Sianas, Artis Kalnish, and some other people, but without result. When Dr. Tsushikana looked at this case, he said, "It's quick case. I will do it very quickly. I will do it in an hour because I have a lot of different things in Kiev. I would like to say, okay, that's good. That's very nice. Okay." He spent 6 hours for this particular patient. I was agreed that it was again failure attempt, but I was agreed, but not him. Yes, and it was a retrograde case with 2 transfemoral 8 French for left, ping pong technique. 8 French with IVAS, etc., and with all possible complications: stent thrombosis, left main dissection, artery perforation. But nevertheless, he did it at finished, and it was complete case, very successful case. It was during live case, and all people in our hall looked at that, and a lot of them knew this patient, etc. And that, yes, it was very interesting case. And for me, it was a lesson that experience and knowledge of CTO equipment and the ability to use it are most important in complex CTO cases. That's the lesson.
Perfect.
Yes,
and that's a fascinating case. I don't think I've heard of a 6-time failed case. I mean, that's obviously an extremely complex case, which brings up the question, how do you balance, as you said, this was complex case, complications can happen. How do you balance how much you push during the case and you do retrograde or other advanced techniques with a potential risk? How do you decide if it's worth being more aggressive to get success, even if there is some risk of complications?
It's very interesting that one of the very important teaching point from the great masters it's that the idea of safety patient on the first place. It's very important because when you start to work, you would like to finish the case successfully, and not all the time it was very safety for patient. Actually, that's why it is necessary to have this balance. I am not sure that I have all the time it, but nevertheless it's very important. I have no complete answer to this question, because I don't feel all the time that I am completely on the safety side in each my intervention. But nevertheless, I am trying.
Perfect. And I think, no one has the full answer to this. As you say, it's something on a case by case that it's individualized. But coming up to you, now you do a lot of things. There's complex cases. You have to run a big department. How do you keep on going? Do you exercise? Do you do some things that help you keep in good shape to be able to do all these tasks, all these roles that you're doing?
No, first of all, it is not completely in the medical area. Yes, I like sport. I like fitness. I rather sportive such man, and I believe that it can help. It can help to support your character and to support you in such difficult cases, especially. It make you tougher in such cases. I believe in that. That's the main idea, is to speak about this condition, sport condition. That's the main idea, as to speak about outside of hospital. But in general, some motivation, some belief, I think is in result maybe.
What sports do you do?
Previously, it was a lot of sports. It was football. It was even in my youth age bodybuilding. I liked very much at that time, and now maybe such physical condition can help to stay a long procedure in operation room with protective shield. That's it. Now I can do it, and I feel more or less. That's it.
Perfect. So you haven't had any issues with the lead and the weight. You've been functioning well, and you think the exercise has been a big part of that.
Maybe. I think so.
Perfect. And then, do you have a favorite movie or a favorite book?
I can't say so, but I like very much a film. I don't know, is it the name in USA is the same, with Tom Hanks' Terminal.
Okay. Yep.
There is such film. It's very kind film. Very kind. I like him very much. I have a habit to look through this film from time to time, and maybe this favorite film, maybe, right?
Yeah, no, I think it's the same.
Speak about book. Yeah, that's good. As to speak about book, medical book, right now I have such a book. It is a book by Kazuaki Mitsudo, Non-Pushing PCI. It was electronic book, and one of my colleagues transferred in paper sample. It's very interesting. No one reference in this book, all his own material. And I am reading it from time to time, and a lot of interesting things I found there. Yes, maybe non-medical book. Actually, I don't have one such favorite book for all the time. It changed from the period of age. I think so.
Perfect. And then, what are things that excite you right now? What do you find? What motivates you right now for the future?
Now our motivation not so as it was before all this military situation. That's why a lot of things and a lot of hopes linked to this situation. That's why all our medical thinking, all our medical plan is closely connected to military situations. That's why now we believe that situation changed for better. Maybe not right now, but in some period, and we can return to our ordinary practice and our everyday life. As to speak, what I impressed maybe in clinical when I work in clinical, besides cardiology. You see, I work in clinic where organ transplants are performed, and I have some intervention in such patient. And sometimes our intervention only one way for those people to survive. It's really impressed for me, and rather such good, I think. And I feel good when I can help in these particular cases after such difficult and long transplantation operation. And that's it. Sometimes our intervention is only one way to save the graft, to save the life. That's it.
Perfect. And then, what are you most proud of on the things you've done so far, personally and professionally?
If we speak about outside my work, maybe my proud, maybe it is my father. Maybe his life, he was a doctor, and I hope in future maybe this will be my son, because he is a doctor too, and maybe he will be a good operator, maybe in cardiology, maybe in another field. That's it.
Perfect. And then, when if you had to give some advice to people, the ones who want to learn how to do these procedures or become CTO or complex operators, what are the things that you think might help them the most to become good, solid operators?
I would say that one of the most important things to get knowledge and get practice, it's a proctoring session, from my point of view. It means that you would invite experienced doctors, experienced operator, and to work with them, and to see all the tips and tricks, all the approaches. And from my point of view, for me, it's my main things to be better. After that, life cases. It's as to speak about practical part, about technical part. Besides that, it's very important to know not only how, but why. That's why you should listen or should go to conference, to congress, to listen the lecture, to understand why you do that. That's it, I think.
And then, do you think it's a good area for the future? So let's say your son, if he wants to become an interventionalist, would you recommend to him to do CT or complex PCI, or would you suggest that he does structural, for example, or other things? What would your advice be?
From my point of view, previously it was the tendency of separation from general endovascular intervention to interventional cardiology to interventional even cheap interventions, etc., etc. But from my point of view, right now, maybe will be the different tendency. Maybe it's worthwhile have more experience in different area, not only in cardiology, maybe in peripheral intervention. Personally, me, I perform some peripheral intervention. I like aortic intervention. We perform aortic intervention. That's why maybe future, when you have a lot of different possibilities and knowledges to be more stable in such competitive environment. Maybe that's it.
Perfect. Well, Sergey, again, it's been amazing. I know that it's actually a privilege. It's things we don't think in other countries right now, that you're able to have this conversation because there's electricity that couldn't be there. So I think you've been an inspiration for many of us that see how you can function at such a high level despite all the adverse conditions. So appreciate you so much for being on the podcast today and giving us your experience and your advice.
Thank you, Manas. It was a great pleasure and honor to communicate to you, to see you here. Thank you once more for your invitation.
Wonderful.
Bye.
Thank you. Thank you for listening to the Sensei podcast.